Before the preparation, I also received those screenshots from the lab. I can clearly see how much I need to cut the zenith. I can see how much we elongate the teeth for the patient. I also have those cross sections. I can see how much I need to equilibrate occlusally the molars, where I need to equilibrate the premolar. So right now I can see in which parts the present tooth structure is crossing the future final design. And then I'm using my two kits. I have one kit for the full crowns, another kit for the veneers and onlays for the preparation, and I finalize all of my preps with enamel chisels that we did with a company called Depler. They are the same sizes as the burrs. I just use them on the marginal zone to create that beautiful, smooth preparation. And all of the preps I usually divide in two parts, the first phase and the second phase. In the first phase, I don't use any retraction. In the second phase, I put the cord in place and then reposition the margin and finalize the preps. What is super important when we speak about the high quality dentistry nowadays is not just to use digital technology, but also to use magnification to control all of the steps of the treatment. And why actually we need to use microscope nowadays? Because we have a few problems. First, if we don't work ergonomically, we can have a back pain. And of course, we have a bad visual control, because if you don't use any magnification, you see the tooth very small and it's very difficult to make a really nice and precise preparation. And with the microscope, we have a complete solution of those problems. We have a really nice, healthy position. We have beautiful ergonomics of cooperation with the assistant and perfect visual control. We can see all of the details with magnification at up to 22 times. And this is really amazing. And you can see that without optics, the angle and position of the neck is about 70 degrees. With binoculars, on average, 30-45 degrees. And with the microscope, we can see it completely straight. Usually I work with magnification 8.5 times, because it gives me a possibility to see the tooth quite close and the neighboring teeth. Then when I remove all the major when I do all the major reduction, after this I can go ahead with the bigger magnification like 13 or up to 22 times to check all of the smallest details. So again, microscope is very important when we speak about the high quality of the treatment on the one side, and on another side, the health of a dentist, because first of all, it's for us to be able to work for a long time, for many years. And then I go ahead with the preparation through the mock-up. So you can see I put the bisacrylic mock-up in the patient's mouth. So now I know what is the final volume of the restorations in the end of the treatment. So I would go ahead, I will start with the depth cuts. So I know 100% that I create enough space for the final future restoration. So the depth cut about 0.4 millimeters on the buccal side, and we have the depth cut around 1 millimeter on the occlusal side. So when the depth cuts are done, I'm going to remove that bisacrylic mock-up from the patient's mouth, and I will see in which parts I actually touched the surface of the tooth. And additionally, after that, when I'm finishing the first phase of preparation, I just use a little bit the electrosurge in this specific case, so to make those two zeniths equal. So I just got a little bit soft tissue on the tooth number 11, just within the sulcus, so no need to do any type of crown lengthening. And then I'm using also the instrument NM4. This is the packer also that I designed with a company called Depler for the retraction. And then I'm repositioning the margins to the new level of the soft tissue using the red burrs for the second phase of preparation, and the speed about 40% of the rotation. So once the preparation is done, I go ahead, I scan the final preps, and I can easily now send them digitally to the lab. Again, doesn't matter how far the lab is. This is how easy it is nowadays to cooperate internationally also. And then in the lab, my cut designer is using data that he already has. I mean, he knows which library to use, because he already has done for us the mock-up, and we transfer it to the patient's mouth so we could demonstrate patient agreed it. So we are just continuing with the same designs for the final restorations. And we have also the face of the patient, we have the functional moves, and we continue with the final results. In this case, I decided to combine two types of materials. So it's Empress and Emax. So we go ahead, we start first with the milling process. We have a really nice accuracy. Nowadays, when we speak about the milling, short production time, and the milling machines, they can work 24/7 and they produce really good and nice precision. I mean, I have plenty of cases where I show under microscope how precise those milled restorations can be. So after finishing the blocks milling process, we go ahead, we take the blocks out of the lab and out of the milling machine, and under microscope, my CAD designer goes ahead with the final steps like polishing and finishing all of those smallest details. And by the way, if you're interested in what our lab is up to, you can just go ahead and scan this QR code and you can check the cases. And if you need help, we can help you. It doesn't matter in which country you work. We can make CAD design for you. We can make for you final restorations. We can plan cases with you completely digitally. So after these restorations are finished, we go ahead to the final step, and the final step actually is the staining process, when the dental technician adds a little bit of those effects on the incisal edge to make sure that those restorations looks nice and they look beautiful. And depending on the patient, some patients they like more intense staining, some patients they like less intense staining. So again, this is something that I discuss with the patient in advance. So our dental technicians, they create those effects depending on the request of the dentist. And then I receive the final restorations from the lab. As you can see here, we have a combination of Empress and also the Emax, completely monolithic restorations with a little bit of the staining. And here you can see the try-in in the patient's mouth, and all this morphology that you see right now, it's what we get from the milling machine. Why? Because again, we are using the natural libraries, and this is how the natural teeth look like. And then I go ahead with the bonding and isolation. So I edge those restoration, I isolate the teeth, I bond the lowers, and then also I bond the upper teeth. So the isolation gives me full control of the bonding procedure. So I don't have any saliva, I don't have any fluids, I don't have any blood in the patient's on the surface of the teeth of the patient. And then the same with the upper teeth. So we have rubber dam in place, complete visual control of the margins. I finish with the bonding, and this is how those restorations look after soft tissue is healing. We allow again the intraoral pictures, but what's most important is how the case looks with the smile and the face of the patient. So here we did the BL3 color, so bleach-free color for the patient, and this is how our patient looks in motion with the little video, because even picture is a moment of aesthetics, but the video is when you can actually see the emotion and how the smile fits the patient face. So 2 years after, the case is in the mouth, looks beautiful. Here you can also check the occlusal surfaces, the functional side of all this story. We also have the retainer for the lower teeth because the patient, you remember, had orthodontic treatment. And again, we have quite nice facial integration of the face, of the smile, sorry. So in this case, you could see actually how we go step by step with the treatment, combining both microscopic approach and digital workflow. So I think this is a great combination nowadays to create those beautiful results for the patients. And remember, the treatment nowadays is facially driven. So this is why when we perform any type of treatment, any type of planning, we always must have face of the patient present, not just articulator, not just the teeth, because in this way, it's way easier to communicate with our lab and other colleagues when we accomplish a treatment for the patient. If you're interested to learn more about the digital workflow, you are very welcome to our training centers. As I said previously, we have a training center in Las Vegas. We have a training center in Kuala Lumpur, Malaysia, where we teach everything about preparation, everything about the digital workflow. All of the participants work with the microscopes, with the phantoms, intraoral scanners, with the milling machines, with the printers. So all the newest technology that you can imagine we have in our training centers. We have 4 modules. We teach everything from planning to bonding from A to Z. You can just go ahead again, scan this QR code and find all of the details. So for this moment, I'd like to say thank you. For me, it was a pleasure to present for you. If you still have any questions left, you can just go ahead and follow my Instagram account and just ask me a question over there. And I would like to wish you, using all this digital technology, using the microscope, always remember that life is too short. It's not only about the teeth. So try to find a balance, work less, produce more, and always have time also to enjoy your life. And I'm sure all this new technology will help you to make this come true. Thank you and have a great day.